today, usually I will start at the head, but you just gotta personalize things based on the person you're working with. So go ahead, take 3 deep breaths for me. Exhale, good, deep breath in. Exhale. And this is just really nice for us to connect and to ground in. I'm not really going anywhere right now. I'm just letting him know that I'm here and I'm present by holding my hands here. And also by adding some pressure with the thumbs onto the feet and towards the ball of the big foot, he can begin to connect to his breath and to his body, feeling sensations all the way from the crown of his head to the tips of his toes. And then I can also begin to observe his breathing and see where he is having any tension or any holding patterns, or maybe what kind of mood he's in today. To settle, I'm just going to take my hands here and bring them down towards the cups of the heels and gently wiggle the body side to side. And what I'm doing with this is I'm looking down the line of his body and I'm looking to see where those kinetic movements go down the kinetic chain of his body. So when I wiggle, I'm saying that he has pretty good movement on the left side, but it's actually kind of getting stuck a little bit on that right side. So even though Chad told me that he has most of his pain and his injury on the left side, what his body is actually telling me that it wants to be touched on this right side. It wants some release there. So when I saw that little side-to-side wave going up the body, my attention got drawn to this spot exactly right here. So I'm not even going to take the top sheet off at this moment. He can stay covered and he can stay in this nice cocoon feeling of being safe underneath the blanket and underneath the drape. He just needs to know that I'm going to attend to what he came into me for specifically. So then I'm just going to move into here. I'm going to say, please take a breath in. And you can breathe into me as much or as little as you'd like. And then on the exhale, just let that soften and smooth. Good. And so I can immediately feel the lower body and the lower back. There's a little bit of a flinch on that first one. And he's already very knowledgeable, so he's starting to breathe into me and regulating that himself. For most clients who don't have that kind of body knowledge, that's something that they need to be cued through without interrupting their inner process. So I'm just holding myself here and I'm not really doing anything except letting him feel into his self and his own inner landscape at this moment. So this is more of a neurological thing than it is a physiological treatment. So this is how we establish trust with the body. Even though Chad's given me his consent to work on him, we've worked together before, I still need to establish and reestablish that rapport and that safety and that trust with each new session. Because who knows what's happened since the last time I've seen him, right? So I would energetically describe this process as something when your partner comes home and they've had a really tough day and you're really excited to see them, but then they're really stressed out, and so it just takes them 15 or 20 minutes to kind of relax and calm down and to ground back into a sense of safety in their environment. So this is essentially what we're doing right now. I'm just holding here and I'm letting him ground into his own sense of safety without really needing to move or change or fix anything. And that reinforces this sense of welcoming and wholeness. All right, so what do we know about the body? We know a lot of things about the body, but even though his pain and his injury was on the left side of the body, we started on the right side because a lot of times the side of the pain is not the cause of the pain, or it's not the area that has the greatest overcompensation for the pain. So it makes a lot of sense to me that if he's trying to hold and protect into this left side of the body, that a lot of the work might go or shift into the right side of the body. And so the right side is actually the side of the body that needs to be addressed first, because it's essentially the team player that's been taking more of the burden or the weight, right? So, but we don't know that pattern until he gets on the table, until I feel what's going on in his body, and I can feel the response of his breath. So even with just a few moments of holding here, the breath has already started to calm and slow down. And so what that's telling me is that now the body might be a little bit more ready, but it's not quite ready for me to go deeper into those areas. So we've at least just touched in and made ourselves known, said, hi, we're here. We're going to work into this space a little bit. And basically by doing this, we're just asking permission. Otherwise, it's a consent violation of the body. So you don't even need to use words to ask consent in this particular scenario and in this particular context of going deeper into the tissue. Okay. So now I've floated up to the upper thoracic, and we're still on the right side. So Chad told me that a lot of his work is very physical and that it's stressful for him to have to go to work while still navigating this injury. And the right side of the body, philosophically, in yoga anyway, yoga philosophy, is the masculine side. And the shoulders, energetically, have a lot to do with what are we carrying? What burdens or responsibilities are we carrying in the world? So again, I'm just holding here. And the invitation for him is to breathe up into me as much or as little as he would like to. There's nothing that needs to happen here. But usually when there's an invitation, we have an inclination to take up a little bit more space with the breath, which is exactly what's going on now. And so since this might be where he carries his work and his job and his sense of obligation, I'm not really going to try to dig that out of him. That's not really something I want to dig out of him. We'll just gently begin to soften around that with the breath and seeing where we can create some more openings and invitations. As part of the healing journey might be that he has to back down or soften away from his work a little bit as a trainer to be able to fully heal himself. And that's a very confronting idea when your livelihood is dependent on your body. So we'll just invite in some compassion for that experience. And right away, notice the scalenes tense up. So that tells me there is a stress component to that here. So again, I'm just going to go back to holding. And he's doing a great job of breathing. And since we're still working with him face down here, the back body is really about a sense of support. It's a really great access point for a lot of the musculature of the body that I need to work on for him. But it's also a sense of allowing himself to be supported as well too. All right, just a hand at the back, right? A lot of times when we're in hustle and grind mode, it's hard to put something else up or slow down enough for a journey of rehabilitation and healing if you feel like you're not in a safe space to do that. So by beginning this kind of rocking motion here, what I'm inviting his nervous system to do is essentially kind of shake out any of that extra stagnancy, any of that extra angst, and just seeing if we can invite some more spaciousness into the body and allowing that to trickle down the rest of the spine. So again, we can further deepen our exploration here as we begin to move on. And it's also giving me a lot of information as I move my way down his back, exactly where I need to go next. So in this way, body work is a conversation. It's not a force. It's not a push. Sometimes it's an ask, but it's mostly just a conversation, right? And I think that's something that a lot of body workers miss, is that you're not going in to fix anything. You're just having a conversation with the body to see where the attention wants to go. So now that I'm here on his erectors, I'm just gently pushing the erectors away from the spine. I can feel this big convergence at the back of his diaphragm on the right side. And my suspicion is that it's very closely connected to the herniation and the pain on his left side. So what I'm going to do is start with the neurological aspects. So this shaking, this rocking is really soothing to the body. And he's doing still a great job of breathing here. So this point on the body is really, really important. It's because it's the There's so many reasons why, but for his case in particular, this is the connection point between the upper and the lower parts of the body. So I want to give this a little bit more spaciousness for the low back to move. If the back of the diaphragm can't move properly, then it's really hard for the lumbar spine to support weight, to load bear properly, and also to mobilize properly. Good. So I'm just taking a few moments. On the inhale, I'm drawing. Good. The intercostals, the serratus posterior. Close in towards the center of the spine. And on the exhale, I'm pushing the erector muscles away from the center of the spine. So I'm only going at his pace. So he's kind of dictating my movements here. And in this way, we're working together. Good. And so now that that's opened up a little bit, I'm just going to hold, and he's going to take a deeper breath automatically. Good. And then we have a nice big release, and then I can have some space to move on. So something that a lot of body workers do is they tend to rush, or they tend to not synchronize their techniques with the client's breathing. So you always want to pay attention to what they're doing. And so now I've moved on to applying pressure towards the direction of the sacrum, pushing down on the SI joint, and also having a hand towards the upper back. Good. And so as I go up the spine, I'm helping him ground by keeping a hand on the sacrum. If we remove that pressure too quickly, then it will feel a little bit too spacey for them, and they might lose their sense of release. So we need to contextualize where we're moving the energy for the receiver. And so again, for him, by keeping this pressure here, gently tractioning towards the heels, he's able to allow the breath to travel up through the rest of the body. And so that's what I want to do. If he's breathing well and the breath is moving the body, we will automatically get some spaciousness and some release into this lumbosacral area. And so it almost doesn't even matter the technicality of it, because I'm just in a conversation with his body, and the body is telling me exactly where it wants me to go. And I'm just kind of following that. I'm tending to it. And sometimes that's a winding path. So we went all the way up, and now we're back down, and now we're in the middle spot again. And so that could be symptomatic of the pattern. A lot of times in chronic inflammation, there's some sort of loop going on. Chronic inflammation is when the loop of inflammation doesn't resolve successfully. And so a lot of times in body work, what that does in the technique is it creates kind of loop-like patterns where we might explore one area, go to a different area, loop around back to it, go to a different area, go back to it again, maybe over the course of one session, even multiple sessions. So that's why ongoing maintenance is really important, because it's not just going to be one time or one input that's going to fix this, especially because it's been 2 years for him. Today, really what we're hoping to do is just to interrupt that loop and that cycle a little bit, just for long enough so that we can introduce a slightly different stimuli, or the body can start to figure out how to successfully resolve that inflammation on its own. Good. And so as we go through this, I'm starting to notice the energy drop a little bit. I'm starting to notice I'm going into parasympathetic state just a little bit more, which is great. I'm feeling a few of the muscles begin to roll. So that means they're releasing, and that means the body is now more receptive to the work. And so this is all great stuff. It means that we're getting into a little bit deeper, that he's in a more relaxed state, and then I will be able, to get a good response from his session. So a lot of times the temptation is, if there's a lot of pain, to dig in and go really, really fast and really hard. We really need the opposite of that, especially for anything that's nervous system related, anything that's neurological. The body will tell you when it's ready to release. We can't force that in any way. Again, that's a violation of consent in the body. So we want to be really respectful. The therapeutic process is full of permission and consent and spaciousness for the body to go through the process it needs to do on its own time. Good. And so there's also a piece here of being able to soften back and down from his work that might be really, really difficult. So this is really important time for him to just receive and release, not need to do anything or move anywhere. And that in itself is also very therapeutic. Good. And so we've moved now to an occipital release and a holding of the sacrum. So notice I still have my hand here, still grounding him out. But now we've moved into the suboccipital region in my left hand. And what that does, it's sort of the information processing center in the body. Our occipital nerve that connects to our eyes and our vision runs through here. And a lot of what goes on here is responsible for how we process information. And so I want him to drop out of the thinking mind and trying to puzzle solve and figure it out. And I want him just to feel connected with his body. So by allowing him to feel grounded, the right hand, and offering this very gentle extension and traction with the left hand, he's able to elongate the spine and also have even more space to breathe into his lower back. Just checking in. How are we doing?
Doing great.
Good. Okay. Perfect. So we're about 12-15 minutes in. I haven't even touched his left side back, even though that's where the pain is in his body. So just to recap, we did the little shake test. We grounded in. The little shake. He saw in his body he wanted me to go to the right side. We gave that space to breathe and to move. And so now there's probably permission for me to go into this left side. So I'm not going to go to somebody's side of pain right away. That could be registered as a violation, or it could be too agitating or sudden for the body. So we always want to soothe and establish rapport first and address any neurological or nervous system related symptoms or reactions before we go into deeper tissue work. So I think we're now about ready. How are you feeling?
Doing great.
Okay, cool.